Hello friends, I am Dr. Dhruv Zutshi. I am a senior consultant in neurology. Today I'll be talking about one of the most common symptoms affecting people. This is called as tremor. Now tremor or kampan as people call it in their local language or in Hindi is of multiple types. Everybody believes that if they have a tremor they are probably having Parkinson's disease, which is not true. Parkinson's disease is actually a very rare disease of all the causes for tremor. So the most common cause of tremor remains an intention or an essential tremor. Now this is a tremor which can be familial, that could be genetic in nature, or could come purely with age after around 60-65 years of age. In this kind of tremors, most patients will have tremor when they try to lift objects, try to hold on to things. So maximum patients will notice that when they try to hold a tray, serving something, their hands are shaking, or they hold a glass of water or a cup of tea, the cup is moving or the glass is moving, and it may cause some embarrassment to them. So this is what is called as essential tremor. However, when they are walking, doing other activities, they are absolutely normal. Now this kind of tremor is so good to identify because it's very easy to treat. There are very good medical therapies available for it in the form of propranolol, primidone, mirtazapine, and rarely other medicines or other modalities are also used. Most patients do very well on treatment. Then tremor can also be an initial symptom amongst patients of Parkinsonism. However, the important thing about this tremor is that it is a resting tremor. I just described an action and postural tremor to you earlier. This is a resting tremor. That is, when the patient is just at rest, the hand starts to move. It is generally asymmetric. That is, initially involves only one limb. Another important thing is that when the patient tries to do an activity, the tremor actually comes down. So the patient never says that while eating or holding a cup of tea I have tremor. It is when I am sitting or just moving around quietly is when my hand starts to tremor. So that is the classic tremor of Parkinsonism. Do not get confused. Then there are tremors caused by patients who are on multiple kinds of drugs like antidepressants, antipsychotics, sleeping pills, sometimes some medicines taken for epilepsy, migraine. These can also, over taken for a long period of time, can cause tremor as a side effect. Commonly, some medicines used by gastroenterologists like levosulpicide, etopride, domperidone can also induce some tremor when used for a prolonged period of time, especially in the elderly. So again, these tremors will be action and postural tremors and not resting tremors. So it is very important to understand that tremor doesn't only mean Parkinsonism, it could mean other disorders which are more likely and more commonly present in the community. Thank you.